It starts silently, no pain, no warning signs, and yet it's one of the most common cancers in men worldwide. Prostate cancer can sit quietly for years or spread aggressively before you even know it's there. In this video, we'll break down how to spot it early, who's most at risk, and the latest treatments that are changing outcomes in 2025. So let's start with the basics. The prostate is a small walnut-sized gland that sits just below the bladder in men. Its main job is to produce seminal fluid, which mixes with sperm to make semen. Prostate cancer happens when cells in the prostate start to grow out of control. Like most cancers, it starts as a small cluster of abnormal cells, and over time it can grow locally or spread to other parts of the body, particularly the bones and lymph nodes. The tricky part is that prostate cancer can behave very differently depending on the type. Some are slow-growing and may never cause problems, while others are aggressive and spread quickly. Now let's talk about risk factors. Age is the #1 factor. Prostate cancer is rare before 40, but risk rises sharply after 50, and most cases are diagnosed in men over 65. Family history is also important. If your father or brother had prostate cancer, your risk doubles. Certain inherited genetic changes like BRCA1 and BRCA2 mutations, which we usually hear about in breast and ovarian cancer, also increase prostate cancer risk. Race and ethnicity matter too. African and Caribbean men have a higher risk, tend to develop prostate cancer younger, and often get more aggressive forms. Lifestyle plays a role. Diets high in red meat, processed foods, and dairy, combined with low physical activity, have been linked to increased risk. Obesity not only raises the chance of getting prostate cancer, but also makes it more likely to be aggressive. And exposure to certain chemicals like those used in firefighting or agriculture has been suggested as a risk. All right, now moving on to signs and symptoms. Here's where it gets interesting. In its early stages, prostate cancer often causes no symptoms at all. That's why it's sometimes picked up during routine screening, rather than because of complaints. When symptoms do appear, they're often related to the urinary system because the prostate surrounds part of the urethra, which is the tube that carries urine out of the body. So men may notice difficulty starting urination, a weak or interrupted urine stream, feeling like they can't fully empty the bladder, or needing to go more often, especially at night. There may also be burning or discomfort when urinating, though that's less common. Some men notice blood in the urine or semen. Sexual symptoms can include erectile dysfunction or painful ejaculation. If the cancer spreads, symptoms can depend on where it goes. The bones are the most common site, so bone pain, especially in the back, hips, or ribs, can be a clue. Advanced disease can cause weight loss, fatigue, or swelling in the legs from lymph node involvement. But again, many men with prostate cancer have no obvious symptoms until the disease is more advanced, which makes regular checkups and screening important. So why do these symptoms happen? The urinary issues are simply because the enlarging prostate squeezes the urethra, like stepping on a garden hose. It blocks the flow. Blood in the urine or semen comes from fragile blood vessels being disrupted by the tumor. Bone pain happens when cancer spreads to the skeleton and causes damage or inflammation. If you're finding this video useful so far, please go ahead and like it and don't forget to subscribe. It helps us reach more people. Now let's talk about how prostate cancer is diagnosed. The process usually begins either with symptoms or with screening tests. The two main screening tools are the PSA test and the digital rectal exam, or DRE. PSA stands for prostate-specific antigen, a protein made by the prostate. Higher levels in the blood can suggest prostate cancer, but they can also be elevated in benign conditions like prostatitis or an enlarged prostate, so it's not a perfect test. The digital rectal exam is when the doctor feels the prostate through the rectum to check for hard areas or nodules. If either test is concerning, the next step is usually an MRI or a prostate biopsy. A biopsy means taking small tissue samples from the prostate with a needle, guided by ultrasound or MRI, and looking at them under a microscope. Once cancer is confirmed, doctors use the Gleason score to describe how aggressive it looks. The score is based on how abnormal the cells are. Higher scores mean more aggressive cancer. Staging tests may include CT scans, bone scans, or PET scans to see if it has spread. Newer imaging techniques like PSMA PET scans have become much more accurate at detecting prostate cancer spread and are widely used as of 2025. Now let's move into treatment and management. Treatment depends on the stage and aggressiveness of the cancer, as well as the patient's age, health, and preferences. For slow-growing cancers that aren't causing symptoms, especially in older men, doctors may recommend active surveillance. This means regular monitoring with PSA tests, imaging, and repeat biopsies, but no immediate treatment. The idea is to avoid side effects of therapy in cancers that may never cause harm. For localized cancer, that is, cancer confined to the prostate, treatment options include surgery, radiation therapy, or sometimes both. Surgery is usually a radical prostatectomy, where the entire prostate is removed. This can be done through open surgery or minimally invasive robotic techniques. Radiation can be delivered from outside the body using beams or internally using implanted radioactive seeds called brachytherapy. For cancers that have spread beyond the prostate or are higher risk, hormonal therapy, also called androgen deprivation therapy, is often used. This works by lowering testosterone, since prostate cancer cells depend on testosterone to grow. Drugs can either stop the body from making testosterone or block its effects. Hormonal therapy is not a cure, but it slows the cancer down. Chemotherapy may be used in advanced cases, particularly when the cancer stops responding to hormonal therapy. In recent years, newer drugs like androgen receptor blockers and targeted therapies have improved outcomes for advanced prostate cancer. Immunotherapy and PARP inhibitors are also being studied and used in certain genetic subtypes. It's also worth noting that treatment comes with side effects. Surgery and radiation can cause urinary incontinence, meaning difficulty controlling urine, and erectile dysfunction because nerves around the prostate are delicate and may be affected. Hormone therapy can lead to hot flashes, loss of bone density, and changes in mood or energy. That's why treatment decisions often involve weighing benefits against risks and discussing what matters most to the patient. Now, supportive care is a big part of prostate cancer management. This can include physical therapy for urinary issues, counseling for sexual health concerns, medications for bone protection, and emotional support. Many men live with prostate cancer for years, and maintaining quality of life is just as important as controlling the disease. What about prognosis? Survival rates have improved dramatically. For localized prostate cancer, the 5-year survival rate is nearly 100%. Even in advanced disease, treatments have extended survival and improved quality of life. But outcomes depend on factors like stage at diagnosis, Gleason score, PSA levels, and overall health. So, final thoughts. Prostate cancer is one of the most common cancers in men worldwide. It often develops silently, which is why awareness, screening, and early detection are so important. Not all prostate cancers behave the same. Some are slow and harmless. Others are aggressive and dangerous. Treatment is highly individualized, ranging from simple monitoring to surgery, radiation, hormonal therapy, and advanced targeted drugs. And while treatments can be tough, most men today live long lives after a prostate cancer diagnosis, thanks to better therapies and earlier detection. And that's our lesson on prostate cancer. If you found it helpful, share this with someone who might benefit, and I'll see you in the next one.